Science with Sally! We love genetic diseases. Not really, but we love to talk about them. Hi, and we're back with some more snazzy info on your favorite genetic diseases. My name is Sally Soward, and I'm your host, or should I say, science enthusiast. So today we have a special guest coming to visit. She spent her whole life researching all about a specific genetic disease called Lou Gehrig's disease. I hear she's even met Lou Gehrig himself. But its more scientific name is amyotrophic lateral sclerosis, or ALS. And because I'm just a curious pupil who has no idea what that is, let's welcome Dr. Lorenza McGee.
Hello, Sally. It's such an honor to be on this amazing show.
And it's such an honor to have quite an esteemed scientist such as yourself. Now we hear you're an expert on Lou Gehrig's disease, and we heard you've met him. I mean, it was probably a long time ago, considering you lived in the 20s and 30s. Is baseball a secret pastime?
Yes, well, I dabble. And yes, I have met Lou. He and I go way back, you know. I went to a lot of his games with front row seats, of course. And that is until he came down with the very disease he was named after.
I see. And it sounds very tragic, and you sure are old. Now, let's move on to the real deets. What is Lou Gehrig's disease?
It is a genetic disease that is caused by a malfunction of the motor neurons in your brain, which are the cells that send messages from your brain to your muscles. Because your brain is unable to send messages to your muscles, they get weak, and eventually the patient loses control of all muscle movement, but the brain is left functional.
Wow! And at what age does this disease usually occur?
The disease can happen at any age. However, symptoms of this disease most commonly start to appear between 55 to 75 years of age.
So you're quite ripe for the picking.
I'm 82.
Oh, nuts! Too late. Well, anyways, what is the appearance of a person with Lou Gehrig's disease?
Well, at first glance, an ALS patient may not be that noticeable. But you'll notice as many patients have slurred speech, are prone to tripping, and have an overall weak stature. However, patients that have been affected for a while are often in wheelchairs and have very little muscle mass due to muscle inability and disuse.
Is it lethal?
Patients often die 3 to 5 years after diagnosis due to muscle infection, heart attacks or failure, blood clots, or most commonly respiratory failure.
Wow, not fun. But let's really get into the science of it. What chromosome is affected, and what error causes this disease?
ALS can be inherited in an autosomal dominant, autosomal recessive, or an X-linked manner. DNA strands often break and may be repaired improperly or not at all. More than 12 different gene changes have been linked to Lou Gehrig's. The type of mutation that affects motor neurons is caused by substitution in the SOD1 gene in chromosome 21. Another gene change linked to ALS is repeat expansion of the hexanucleotide on chromosome 9.
Sounds very complicated. Lou Gehrig's does not seem to have a definite cause. In fact, a source tells us that only 10% of patients have hereditary ALS.
Yes, and the familial mutation is usually the mutation of the SOD1 gene. However, if you have this disease, there are screenings available. Screenings for ALS involve signs observed in physical and neurological examinations and tests ruling out other problems. Tests for ALS include blood and urine tests, MRI, muscle biopsy, respiratory testing, etc.
So we know what the disease is and how it's caused. But is there a cure?
There isn't any cure for ALS that can fix the damage, but there are 2 medications that can help expand the lifespan of ALS sufferers. One is edaravone, which is given through IV with side effects of bruising, unsteady gait, and headache. The other is riluzole that is taken orally with side effects of gastric distress, bruising, and dizziness.
And how does this affect the daily lives of the patient and their family?
While children with parents who have ALS have very significant emotional and behavioral problems, internalizing problems, and symptoms of depression. They also tend to have adjustment difficulties, psychological pain, and thought problems. Considering the physical impairment caused by the disease, it is difficult to do any sort of task that involves muscle movement by themselves. This may put a lot of stress on families as the patient needs a 24-hour care. However, as Lou Gehrig's disease does not affect the brain other than the motor neurons, patients are able to use their minds to their full capacity and can still contribute to society in this way.
That is very interesting. They can't use almost their entire body, but they still have their personality and can still learn and read and think. Amazing. Well, thank you, Dr. McGee, for sharing your intellect with us, and I hope your retirement is as amazing as the concept of science.
I'm getting younger every day, Sally.
Of course. Well, thanks for tuning in to Science with Sally. We'll see you next time.